Welcome, everybody. This is our weekly DPH COVID-19 and vaccine update. We have been doing these since we went bi-weekly, just as a way to check in and see how numbers are going, and also just share any relevant information. So welcome and thanks for joining us, Rosemarie.
Thank you for having me.
Awesome. Well, I'm going to hand it over to you and I'll do some talking on the back end, but it's yours.
Okay, and then you'll be asking me questions like you normally do. Okay, sounds good. So here's our numbers for as of yesterday at 5:38 p.m. The number of COVID cases is increased to 93,363, and which is about 1,600 more from last week. And we've processed another 19,183 test results. Unfortunately, we've had an additional 66 deaths since last week that have been registered. Our overall hospitalizations, as you can see, they're decreasing, which is great, but they're still really busy. They have lots of other types of health issues that are impacting the ICUs. So we're still like at 0% capacity in our hospitals. So next slide.
What's the update on the dashboard? I haven't asked in our main Thursday gatherings, but is there a timeline on the data dashboard? Or
yeah, actually, we just got an update this morning, and that's why I appreciate your flexibility in recording a little bit later this morning. We found out that we're hoping that we're able to go live with our dashboard, our new dashboard, which is supposed to look really cool, tomorrow. So hopefully,
okay, hot off the press here.
So hopefully everything goes well. You know how it goes with technology. So, sure. But if it doesn't happen tomorrow for whatever reason, it should be there very soon. So, okay. Yeah, we're excited about that too.
Cool.
Okay. So, yeah. Okay. So our hospitals. So currently we are at 324 hospitalized patients, and last week it was 369. So you can see that continuing downward trend. And then as of yesterday, we were reporting 17 ICU beds available, and last week it was 15. So the ICU bed stuff still continues to fluctuate, and a lot of that has to do with other health needs, as we talked about earlier. So that's still fluctuating. Next slide. Okay, so we have some semi-good news. Our positivity rate is doing really well. We went down to 7.9 in our positivity rate. So we're in the red for that sector of the blueprint, which is great. And our case rate continues to go down as well. It's now at 22.8, and it was from 30.3 last week. And so we're definitely heading in the right direction, but we still need your help with keeping that downward trend. So please continue with your outreach and education. Our testing continues to be a little stable at 4,100, because that's what it was last week. And our health equity metric improved a little bit as far as the gap between our overall positivity rate and our health equity metric. So we're at 10 this week. And so the gap is a little bit smaller, which is great. So keep on helping us with those messages like I talked about. And, please encourage folks to wear the mask, wash the hands, watch their distance, and be wary of crowds. Not everybody's getting vaccinated yet. So please continue with those messaging. I just wanted to also make well, you can keep it here. There's a special note that there's been, messaging about schools that if the case rate is below 25 per 100,000 for 5 consecutive days, schools, can be reopening K through 6 in the purple tier that have already received their waiver. So, schools you've been hearing on the news, they're all trying to open up, starting, next week and so forth. So there is that guidance. And then on the state, they have a whole guidance that was, I think the date was in January that it was updated. So we'll let you know if that gets updated anytime soon. Okay, next slide. Oh, you're right there. Okay. And so what we did is, because vaccines are so important, we've kept up the link for the vaccine schedule. It has not changed since last week. But we also we provided you here with a vaccine provider site link, and that just got updated yesterday because we added, there were some missing Valley Health Team locations that needed to get added. And I just also wanted to mention the Sierra Pacific Orthopedic Center and UHC is now listed on the provider site list instead of directly on our vaccine page. So we're putting all the providers into one area. So please, go there for their links and so forth. Additionally, we found out this morning there's going to be some new sports guidance that's going to be coming out today, actually, from the state. They'll release it, and then the health department will take a look at it and review it and see how we craft, our own messaging ourselves, and so that we can provide the really good information to all the schools. And I think the specific changes that are going to be part of that guidance are for the high contact sports. So probably like football and basketball and so forth. So that's exciting. So it'll be interesting to see what the state guidance has for that. Next. Here I know I always preach this, but I want to continue to preach. The COVID testing is still really important. So don't forget about our OptumServe testing locations. And I'll have a little bit more information on all of the OptumServe testing in a little bit. But so please encourage folks to get tested if they're not feeling well. And, because you have to remember, if our testing rate falls below the medium state rate of testing, we get dinged on our case rate, and we could actually, it gets adjusted to a higher rate than it actually is. So testing is still really important for us if we want to continue to move to that red tier and continue getting to the orange tier and through the tiers. So please continue helping us to promote the testing. Next slide. Okay, and I have a few rural testing events flyers that I wanted to highlight for you this week. The one on the left is happening at the Kerman Community Center every Friday through February 26th. So this will be technically ending. I'm not sure if it's going to continue, but it will be it'll be this Friday from 12 p.m. to 2 p.m. And the flyer in the middle is from Mendota Community Center, and it's also happening every Friday until February 26th. And this one will be from 4 p.m. to 6 p.m. And the flyer on the right is the Del Rey testing event at Alex Fonseca Park, scheduled for this Saturday, February 20th, from 9 a.m. to 1 p.m. So, please check out our testing page for any other flyers, or if you want to download this and make sure to share it with the community that you're serving. Next. Okay, and these are upcoming Tuesday events. So the first flyer on the left is a testing event that's happening at Chickchansey Park beginning at 12 p.m. The middle flyer is a testing event at Ringo Park in Selma. That one is from 3 to 6 p.m. And the flyer on the right is for a testing event that's happening at Fresno EOC Plaza starting at 3 p.m. And don't forget, all these testing events are on Tuesday. So these are on February 23rd next week. And don't forget about our FQH testing events that are listed on our website calendar on the testing page. Those are really important to go there and find a testing site that's more local to where your community resides. It's very important, especially with transportation issues. Okay, vaccines. Okay, so I know I'm not as good as Joe, and I don't have all of the details, but I'll do my best.
We're glad to have you, Rosemarie.
So I heard from Joe this morning, and yesterday, so we're good. So the health department's plan, for the rest of this February, will be heavily focused on vaccines 65 plus. The healthcare folks, they can, if they miss that initial push, they can still get their vaccine, and they can go to any FQHC or vaccination clinics, and they should, as long as they have some form of ID that shows that they're a healthcare worker, they should be able to get in, even if they're, below 65 years of age. They'll just need to prove that they're a healthcare worker. We have mobile vaccination clinics that are being hosted right now. And one is being hosted by Fresno State and St. Agnes. And they're targeting our rural unincorporated areas, which is very important to us right now, especially in those unincorporated areas that don't have immediate access or close access, I guess I would say, to a federally qualified health center or provider. So we're really trying to target the rural communities this way. And then also the health department has a mobile vaccination clinics that's going to the skilled nursing facilities to get the patients and staff within those facilities vaccinated. So those are two important, sectors for us, right, population-wise. And then currently, I also want to mention and kind of impress upon everybody, get used to that My Turn. Everybody's kind of slowly transitioning to that My Turn app to do all of our scheduling and so forth. It's not perfect because it's brand new, so be patient with that. And you can always call us if you've got questions, but they have a toll-free number as well if you're having trouble. So, and then Reedley College is starting today, and we'll be accepting vaccination appointments for February 19th, which is tomorrow. And appointments are available through My Turn as well. So you can see everybody's moving to My Turn. So I would encourage everybody to get comfortable with that. Maybe as a CBO, you can learn it yourself, and then you'll be able to help the community residents that you serve who are having troubles with that.
Will you all be putting, how will that transition go in Fresno County from your SurveyMonkey interest form to My Turn? Will those integrate at all, or?
Yeah, except for the Gaston Middle School, we're still going to keep that vaccine interest form, and we're still going to pull from it when we have some, maybe we have some doses left over at the end of the day, and we're going to call to see. And we've been doing that, and we've been happily surprised that a lot of them say, "Oh, I already have my second dose appointment scheduled with my local clinic." So then we move on to the next person. And then Gaston Middle School is right now only using the vaccine interest form because they're targeting that specific population 93706. And My Turn right now doesn't have like private type clinic aspect on it yet. So, but for the most part, everybody's using that My Turn. They're transitioning to that. We're going to have an app here on our county website here soon that's going to go live. So keep looking for that and check that out. But I just encourage everybody to get familiar with it so that you can help you and your family and of course the communities that you're serving. Because I'm sure it's good. Yep. Because it's
I put my info in last week just so I could use it and see how it goes. And so I'd say the same to everybody. Put your info in.
Good. Yeah. And then I also just, can you go back real quick? Just a reminder too, for the My Turn, just remember too, there's that it's not 1-800 actually, it's a toll-free number, 1-833-422-4255. So that's if people are having trouble with internet, or I'm sure you can call and ask questions. It looks like they have a lot of language capabilities, over 254 languages, primarily English and Spanish. So that would be a good resource for folks as well. Okay, next slide. Okay, so just continue to help us with our the messages about it takes about 2 weeks for the vaccine to protect you to become fully vaccinated, and you still need to follow those masking, physical distancing, and the no gatherings guidance, because not everybody's getting vaccinated. We still don't know if somebody who's been vaccinated, we know it's preventing that from them getting it, but we don't know if they still can transmit it to somebody else if they've been exposed. Also, I wanted to let you know the county to date has received 133,000 doses Food and ag is estimated to begin in March, beginning with, we're going to target our outbreak sites first and get them vaccinated, and then kind of move from there. We have a couple of leads here in the department that are outreaching to all of our food and ag and seeing who's interested. And as Joe's talked about, a lot of the agriculture community is banding together and inviting other local companies to come in and get vaccinated too. So that's awesome. And then childcare and education, they're also estimated to begin in March. We're still working with those sectors to figure out how to do that, through an equity lens. I'm assuming, that folks, whoever within the schools, is going to be prioritized based on, who's on campus, who's exposed to other staff and children, and the age is going to be really important as well. So all of those factors are being played in. We did find out this morning that there's been a delay in the Moderna vaccine shipment this week, and we're hoping to receive it tomorrow. I'm assuming it's maybe due to the weather. Everything's being backed up a little bit. But the health department is working with our local providers here in Fresno County who are Moderna providers, and we're making sure that we're pulling from our freezer and giving it to them to make sure that they're whole and they can do their clinics this week until we can get them, more of the Moderna. So, and then next week's allocation is looking projected to be 21,000. So that's really good.
Great.
We're excited
really
about
good.
that. In Fresno County, there are 4 CVS locations and 13 Rite Aid locations that are going to be receiving the direct federal shipments of vaccine. And because it's a federal program, you're not going to use My Turn. You're going to use their direct links from their websites. So we provided the links here for you. And so encourage you to go there, and they should be following, the same tier, 65 plus and so forth. And then we understand that Vons and Save Mart pharmacies are also approved providers, but we don't believe that they've received any shipments yet. There must be still kind of in the planning phase and kind of figuring all of that out. So,
and that number is not included in the 21 that you're estimating for next week.
Yeah, because these are federal.
Federal
these
direct,
are federal allocations. So this is not.
Any sense of the size of how many they received? Do you have any idea?
No, I don't, unfortunately. But when I hear that information, I'll make sure to share it. And then I think that's it on this one. Oh, and then Blue Shield and Kaiser, the third-party administrator. We met with them last Friday, and it was a very productive meeting because Central Valley is part of that first wave. I think Riverside might be part of the first wave as well, but Central Valley is part of that first wave. And they were actually very impressed with what we are doing here in Fresno County. And they're going to be submitting a plan to us that shows how they can align with what we're doing here as much as possible. And so we're looking forward to this partnership. And seeing how it will come to fruition. And the Blue Shield, they're going to be utilizing the Optum Serve locations to expand. So, we're going to be doing Reedley first. And so, but with Blue Shield, the plan and the hope is that we can expand it to all of our other local Optum Serve sites. And they'll be doing so many clinics a week, because it'll become like a dual site. Well, they'll do vaccines and testing. I'm just not sure. I'm assuming it's going to happen separately on separate days, but I'm not sure yet. So as we get more information about that, we'll be sure to share that with you as well.
And when does that transition start with Blue Shields and Kaiser?
I think technically it starts, it kind of starts next week, but you still got to do the planning and all of that kind of stuff.
Yeah.
So,
okay.
So it's I think it might not be fully engaged maybe until March, beginning of March. Yeah. But I will make sure to provide, and I'm sure Joe will provide more updates next week for that one. On this particular slide, the only thing what we did was we moved the what to expect after getting COVID-19 vaccine flyer to this page, because we think it's an important link for everybody to kind of have easy access to. on a regular basis when you're, because you can utilize this and share these flyers with your family and friends and the community you serve. However, you know, they should be receiving something from the clinic that they get the, you know, that they get their vaccine from. So, but it's nice for you all to have this information handy too, in case something slips, or they just want more information. And because you all are a trusted resource in your community, and they may want to confirm the information with you, you know, I don't know. So it's good to have that information. And that's it.
Awesome. I think I asked my questions along the way. So we'll be meeting next week. So for everybody, same time, 9 o'clock on Thursday. Joe Prado will share, Rosemarie will share, and then our other focus kind of topic is looking at community engagement. So even as we've begun to do, you know, as part of, you know, COVID equity, and a lot of this work is, how do we as CBOs, how do we as a community begin to shift the way we do planning and our engagement, so that we are actually taking community voice in through the whole process. So that'll be next week. We'll be sharing there, and I look forward to having you join us. Thanks, Rosemarie.
Oh, thank you, Andrew. Have a good weekend, everybody. Stay safe.